Sitting, Community Health Center. You see a 22-year-old patient who has had a cold and as a result has a build-up of mucus and a constant need to clear her throat. She wants some advice on the treatment. Now, let's see the task. First one says, find out the reason for the patient's visit. Second one says, find out more details of symptoms such as runny nose, color of mucus, facial pain, reduced sense of smell or taste. Third one says, outline ways to relieve catarrh. Drink cold water before clearing. Saline nasal rinse. Avoid warm and dry atmosphere. Stay well hydrated. Fourth one says, suggest over-the-counter medication, decongestants, antihistamines, etc. Fifth one says, resist request for prescription. Unnecessary, not your role. Sixth one says, reassure patient about catarrh, usually temporary, not harmful, self-limiting. Seventh one says, advise need to see general practitioner if problem persists for more than 6 weeks. Rule out any underlying conditions or unidentified food sensitivity. Now let's begin the role play. Hi, good morning. I'm John, one of the nurses working in this community health center. May I know your name and age for record, please?
Good morning, nurse. My name is Sarah and I'm 22 years old.
Okay, Sarah. May I know the reason behind your visit?
Sure, nurse. I have had a cold for almost a couple of weeks and as a result of it, the mucus has built up. Therefore, I need to clear my throat a lot. I feel this as quite unpleasant, not just for me, but for the people around me as well. So I'm a little worried. That is why I'm here for your advice.
I understand your concern, Sarah, but try not to be worried. This condition can be well managed with certain treatment modalities. Before proceeding to the solution, I would like to ask you a few questions to know more about your symptoms. May I proceed with that?
Yes, nurse. Please proceed.
Okay, Sarah. Do you have a runny nose?
Actually, I do not have a runny nose, but I was coughing a lot.
May I know the color of mucus?
Nurse, I cough up a lot of white mucus, and as a result, my face and neck hurt as well.
I understand the situation, Sarah. May I know if this reduces a sense of smell or taste?
No, nurse. My senses of smell and taste are normal.
Glad to know that. Now let me outline the ways to relieve your condition, which is called catarrh. It usually happens when mucus accumulates in your nose, throat, or sinuses. Moreover, it is most commonly associated with infections, allergies, and changes in the weather. But don't be worried too much. This can be effectively manageable by following certain remedial measures. Okay, Sarah, I hope you're following me.
Yes, nurse.
First of all, it is highly recommended to take a cold drink before clearing your throat, along with rinsing your nasal passages with saline solution to wash away allergens and mucus. Saline is said to help moisten mucus membranes and wash away allergens and mucus from your nasal passages. Okay, Sarah, I hope you're following me.
Yes, nurse.
Apart from that, it is also important to avoid warm and dry atmosphere. And make sure to take enough water to keep you hydrated. You can also take some over-the-counter medications, particularly decongestants, which are medicines that can provide short-term relief for blocked or stuffy nose. Additionally, you can also take antihistamines to relieve nasal congestion.
Okay, nurse, thank you. I was hoping that you would give me a prescription for something which would be more effective than the over-the-counter medication.
Your thoughts are natural, Sarah. However, I'm sorry to say that I'm not the authorized person to provide you with the prescription because it's not my role. Moreover, a prescription is not really necessary for your condition. I hope it's clear for you.
Okay, nurse, I understand that. I will try over-the-counter medications. But nurse, I'm worried that the problem might carry on for a long time.
Your worries are really understandable, Sarah. Don't panic. I can reassure you that the catarrh is usually temporary and it is not harmful to be worried about, and it is self-limiting condition without any medication. Okay, Sarah. However, I would suggest you to see your general practitioner if the problem persists for more than 6 weeks, so that he can go for a detailed examination to rule out the underlying condition or unidentified food sensitivity. Okay, Sarah, do you have anything to be clarified?
No, nurse, thank you. I'll certainly follow your instructions, and I will make an appointment with the general practitioner if there is no improvement, even after 6 weeks.
Happy to know that, Sarah. I hope I have clarified all your concerns and questions. If you have any more questions or concerns, you can contact me at any time. I will be glad to assist you. Thank you, Sarah, for visiting our community health center. I wish you a faster recovery.
Thank you, nurse. Thanks a lot.
Thank you all. Our role play ends here.